So basically, for power athletes, if you do something, for example, power lifting, you probably
Yeah,
improve. Yeah.
short.
But then if you do anything exhaustive, you get worse. And the endurance persons can get exhausted and they still improve.
I am remembering now, for example, practice for a specialization course of exercise physiology in Brazil. I performed, and this practice was basically I asked for some endurance runners, some recreational endurance runners, and for some strength training, resistance training students from the group, okay? All recreational. And we compared in this sample of students, or making first 5 minutes warm up, running some maximal running, plus more time running, or plus some sets of high intensity squats.
Mm.
Okay. And with this practice, it was very evident that those who were adapted to long, prolonged endurance running improved the jumping height more with the endurance running, and those doing habitually resistance training improved the jumping height more with the sets of high intensity squats.
And do you know if there's studies that has been studied with the isolated muscle in a way, in a very simple, for example, just knee extension? Because I'm thinking, could it be related just to coordination that if you're not super confident that you are warmed up, you are, for example, in the knee extension, you are afraid of hamstrings, and you could kind of limit the speed or the exertion of the quadriceps to protect the hamstrings. Could this be just kind of muscle coordination, or do you see it in an isolated muscle in a way? I'm just thinking, could it be linked to the kind of coordination of activity? And could it be that you just warm up enough and you, for example, if you activate quadriceps hard, you stretch the hamstring and you might be afraid of your hamstrings subconsciously, that it's kind of a warm-up effect and just improves your coordination. So is there studies looking just isolated muscle or very simple movement, or do you see a difference between kind of squat and, for example, just knee extension?
Okay, good point. Classic studies with, for example, isolated contraction, isometric contractions are effective, but this effect is in the short term,
Mm.
okay? And it's a very local effect. The classic post-activation potentiation with the twitch verification means that it's a very local peripheral effect.
Mm.
But when we are trying to increase our performance through the warm-up, we're trying to increase our metabolism
Mm.
and to increase the whole body temperature, because it is not only good for the muscles, active muscles, the agonist muscle, but also for the metabolism in the case we need more aerobic and anaerobic energy. So my suggestion would be that for more situations, trying to perform more whole body or a mix or specific with whole body exercises.
Yeah, and I remember reading the book about lower back problems or something, and there was that if you do this, they have this Pt3. I think Stuart McGill is the author, that if you do the certain activation for core muscles, then the performance enhanced because you were able to activate your core muscles better. So I think there's many things in play, and I think you are doing important work trying to kind of
Mhm.
divide it to different parts. And again, we come to this, that as a coach, you need to have quite a bit of knowledge to figure out that what's going on.
Yeah, and there are lots of different techniques to increase performance during the warm up. For example, imaginary, mental imaginary. You can not only perform body exercises, but also imagine the exercise, the next performance. And this has evidence of improving that. Or applying passive techniques, for example, as heating or static stretching assisted, etc. So the point is to know the demands of the next activity to design a mix of different exercises, approaches, to increase the whole performance.
Yeah, makes sense. And then if we move to next topic, you have been writing about the evolutionary significance of fatigue. Sounds very interesting. Could you tell us more?
Wow. Well, from this point of view, fatigue is basically a protective mechanism of homeostasis. So the signs of fatigue, both acute and the long-term signs of fatigue, and remember that fatigue has different meanings. We can differentiate between muscle, between central fatigue, and so on. There is very different meanings for fatigue, but anyway, we should look at to fatigue as a complex mix of very different symptoms that help us to identify that our body or organism is maybe asking for some recovery or to reduce the training load. So from an evolutionary point of view, this links also to motivation, because the motivation makes sense when you are analyzing both your sources and the objectives you are pursuing. Okay. So from a psychological point of view, you are trying to use all your sources to pursue the objective. You perceive that this objective is achievable. Okay. So we, with our mental capacity, can even surpass the biological premise. It means, for example, that in some cases, extreme cases, we can perturb in a very harm the way, because we are looking for a bigger objective, which is more important than our homeostasis. And remember, in this case, athletes that are in danger of death increase. For example, when finishing a marathon, the classic example in these female athletes in the Los Angeles Olympics and so on. So it's a very complex phenomenon, but basically, if we view that all our responses are based on evolutionary adaptations, we should remember in any case that fatigue symptoms are good symptoms to identify the necessity of recovery or lowering the training load.
Yeah, I think it's very complex. As an athlete, you kind of try to push the boundary, but you also need to know when you shouldn't go over, and it's not an easy task, because if you never go over the boundary, over the limit, you never know if you're pushing enough. So you kind of just balancing on the limit, right?
Yeah, it's not the same the objective for a professional athlete than for a recreational athlete, for example. It's very, and this makes sense because of the objective. Maybe resilience is also linked to the objective.
Yeah. And how would you think, how good coaches, athletes use this? Do you see it's just the information that you should recover? What other insights you could get from the kind of the evolutionary perspective?
If we think with an evolutionary point of view, we can better understand all the responses. For example, when you asked me about Harry variability and the fine tuning, etc., I put the example of Harry variability to identify overreaching. When Harry variabilities increase, acutely increase, or an increase in the short term. So the interpretation of this response is more easy if you put this into an evolutionary context, because, okay, Harry variability is increasing. This means more vagal modulation. And what this means? Oh, maybe this means that our body is trying to save energy, because for survival, we need to save energy in context in which our bodies has lots of demands or is in risk of death or another risk. So I think having some evolutionary thinking is useful in the context of sports training.
Yeah, I do agree. And maybe the last topic for this episode about the personalized training load and injury risk management. Could you tell more about the article and topic about the personalized training load and injury risk management?
Okay, injury risk. What article is referring this? Because
Could
Sorry, because I have lots of
Yeah, yeah, yeah,
collaborations,
yeah, yeah.
and I can remember now the exact.
Yeah. Is it do you play or do you train insights from individual sports?
Okay,
Yeah.
yeah, I did.
Yep.
Thank you. This is an opinion article, and this article presents some key issues in elite training and mostly in team sports because of the very dense calendar. Okay, because in most cases nowadays, for example, the most typical example is in professional football, professional soccer. Basically, they are not training and competing. They are recovering all the time between matches. So that's the reason of the title of the opinion article. Do you play or do you trade?
Yeah.
Because playing twice or more times every week means that it's impossible to train or try to increase. Basically, you are recovering between matches. From this perspective, it's important, and this links with the fine tuning approach, to look for all the parameters, all the information, and having a very good communication with all the staff, not only physiologists, but also the coaches, the nutritionists, the physiotherapists, to have a whole approach for the intervention to try to not only enhance performance, but mostly recover in an individual basis, considering all these perspectives.
Yeah. And how do you see, like, basically, if we talk about football, basically the matches are the training. So you don't, like you said, between the matches, you are just recovering, and the basic stimulus for kind of endurance, for example, probably comes from the matches for many positions, right?
For me, the key point in this case is that in team sports, which are situational sports, okay, physical fitness is not a key determinant for success for performance, because technical, tactical performance is more important than physical fitness. But physical fitness should be the base or the facilitator to develop your technical, tactical performance. For example, in an individual sport, you need to increase at its highest a few capacities. An endurance athlete should increase the VO2 max, the threshold, and so on. Okay. And it's not very easy, but you should focus on a few capacities, and you can predict performance from a physical fitness perspective. Okay. But in team sport, because technical tactical performance is the key determinator of performance, the physical fitness is only a facilitator. So you should achieve the minimum physical fitness, which allows the development of your technical tactical performance. That's the reason, because in team sports, for example, in soccer, you can increase your physical fitness in one more to a level. And if you are able to maintain that level over the season, you can maintain your technical tactical performance, obviously, if you are with a good nutrition, recovery, etc.
Yeah, makes sense. And in a way, because they are playing almost throughout the year, you kind of need to manage that you can keep up the fitness. Like in short term, maybe you just concentrate on the matches, but then you need to be also in 2 months having the enough fitness, having
Yeah,
enough,
keep
yeah,
doing the
enough,
same to
yeah,
maintain. And if you identify some kind of overreaching, it's time to recover or for some
yeah,
rest.
makes sense. Very interesting things. It starts to be a little bit late for both of us, so maybe we start wrapping up. You have been doing many kind of things. What kind of upcoming studies you have? Are you looking for any collaboration? Do you want to advertise anything? Feel free to tell anything.
Okay, I worked mostly in sports science, but from recent years are moving also to clinical studies with clinical populations. So we developed some studies with depression patients, and with now we are running a project with hypertensive patients. Okay, we are starting also here in Leon and in other hospitals in Spain with HIV patients. So we are looking for some relationships between fitness, quality of life, and physical activity through the monitoring of physical activity levels. So now I am not moving, but I am trying to perform both in sports science and at the same time, because the money is there, with health, mostly with clinical population. And we are more interested also in the effectiveness of short sprints for clinical populations, because with short sprints in a very few sessions, you can increase the aerobic capacity. So this is very good for clinical populations. And with this increase in the aerobic capacity and the oxidative capacity, you can increase the quality of life very fast. And this makes easier the patients to increase a more complex and more complete physical exercise intervention to increase the quality of life.
Yeah, sounds very good. And you've been testing our Fibion Sense device. Could you tell a little bit of your feelings using it and your experiences?
Okay, I have some experience with the classic accelerometers, pedometers, and for me, Fibion is very nice because the patients forget they are using them. So I think this is one of the strengths of this technology. And apart from this, because we are also working with my colleague and friend Matthew Stulz-Kolemainen with the link between motivation for movement and physical activity, we can also track this motivation for movement with the scales linked mobile, okay, and with the accelerometer with the physical activity levels. So for me, this is an important advance with this technology.
Yeah, sounds good and good to hear. This has been really interesting discussions. So thank you, Daniel, for taking the time for the podcast.
Thank you very much to you. It was a very nice conversation, despite being in the exams times here. So it's not easy for me.
Yeah, perfect. Thank you.